Welcome back to Healthwise. With us is Dr. Carl Gonsolin, pediatric dentist. And Dr. Gonsolin and I were talking about what could be done as far as helping the kids study in school and whatever. And basically, Doc, if you're in school and you have a tooth problem, what problems does that cause?
Well, if you're hurting, how can you pay attention to what you're doing? You know, how can you learn what you're going to school to get the basic information so that you can learn what to do to make a living. And so you need to get these basics, and if you're hurting, you're not going to get it. You're going to miss something, okay? Mm-hmm. And certainly you're not going to be comfortable as well, but your attention is not going to be on your studying, your attention is going to be on your teeth that's hurting. So we encourage to keep the kids healthy. Prevention is the best route. Okay, but if there's something needs to be done, let's get that done quickly before it gets to be a big problem. It's easy to fix. It works better because you don't have a big complicated repair. The tooth can hold up better, and it's a little bit easier on the pocketbook, so that's good. Okay, but the child is now, his attention is not on his teeth. His attention can now be on his studying, and he can get the most out of studying. You have kids that they're losing baby teeth. Sometimes you can have a little problem with the baby tooth. It can maybe split in half. It gets real thin and it can split or break or something like that. Or maybe it's a little bothering them and they're having a little bit of pain on that. Maybe they need to do something to get that taken care of, and we don't want to tie any strings to the doorknobs, okay? But, you know, if encouraging the child to wiggle his tooth out, you know, and that can work. You know, you keep talking about how much money the tooth fairy is going to give them there, you know, it can do quite a bit of, you can be surprised how fast it takes they get that tooth out. But they may also need professional attention, and so, you know, that's what the dentist is there to help with that. So their attention can now be on their studying and not on what's going on hurting them.
We were talking about, I mean, you know, there are going to be accidents probably in school. You know, kids today, they're not rough like we were back in school, but they still do fall. They play football, they play basketball, they do all kind of little things. What can be done to help prevent tooth damage in like day-to-day at school? Well,
it's easy to get hit in the mouth and chip or break a tooth or knock a tooth out or something like that. The first thing, if a child is in a contact sport, they should be wearing a good mouth protector, a mouth guard of some sort. You can get one, the best ones of course can be the ones that are professionally made, so they can be really custom fitted. But there are a lot of very good over-the-counter mouth guards that work very well, but they should wear the mouth guard. And so that's one thing. Generally the schools are prepared somewhat that if there's an accident they can know what to do with the accident, but if a child hits a tooth, knocks a tooth loose or breaks it or knocks it out, he should get immediate attention, because you can't tell how bad the injury was just from looking at the tooth. Sometimes you have a fractured root which you didn't know about. Sometimes the nerve has been exposed from the breaking of the tooth. All those things require quick attention, because the sooner you can get to it, the better chance you have of saving the tooth. And especially if a tooth is knocked out. If a permanent tooth is knocked out, you want to do something as quickly as you can, and time is of the utmost in those cases. So first thing you want to do is you want to, after you've taken care of the first aid for the child, you want to make sure that tooth is kept in a wet solution. Water is not as good. Milk would be a good solution. There are solutions that are made especially for teeth. Maybe the school has it, but if they don't, you put it in some milk and bring the child and the tooth to the dentist. And maybe it could be saved. Maybe it can be saved, exactly.
Okay. Well, Doc, we got about a few minutes left. We got a half a minute left. I said a few minutes. We got a half a minute left. And you want to take this time to kind of tell us again, tell the audience again where your practice is and...
All right. Well, I'm practicing with my sister in the All Center in Lafayette, 126 Hospital Drive. And like I said, we are now welcoming our new family dentist, Dr. Lisa Williams. And she's there to help the parents and the older kids, and so that we can help the parents, help the kids from cradle to grave, you know. And
well, thanks, Doc, for joining us, and you're welcome anytime, and thanks for telling the audience about good dental health. And thank you, audience, for joining us on Healthwise. We'll see you next week.
Healthwise is brought to you in part by Opelousas General Health System.